Perhaps the most effective conservative treatment for knee arthritis is electrical dry needling. A recent study found that it reduces knee pain from almost a 6 out of 10 on average to less than a 2 out of 10. This is a 67% or a 2/3 reduction in knee pain, which is something you don't see with the vast majority of treatment approaches. And as you might expect, whenever you reduce knee pain, you also reduce the reliance on pain medication. Patients who received this electrical dry needling were almost twice as likely to completely stop pain medication for their knee. And maybe the most important finding from this research project was that these patients were 400% more likely to report a successful outcome. Now, I understand that this might be hard to believe. People just don't understand how this approach could help someone with arthritis. I'm basically sitting here and telling you that I can stick needles into somebody, hook it up to electrical current, and help their arthritis. And I understand that's hard to believe. But what I want you to know is that there's actually some really good research out there that talks about the effects of this electrical dry needling on the knee joint. So there were some studies that actually looked at blood flow around the knee in response to this electrical dry needling. And whenever these patients received this treatment, there was actually an increase in the size of these small blood vessels around the knee joint immediately after the treatment. And what this means from a practical standpoint is that there's actually an increased ability for oxygen and other nutrients to get to the knee, which stimulates the healing process. Some other researchers actually looked at some of the chemicals within the bloodstream after electrical dry needling. And what they found was an increase in compounds that are called endorphins and a decrease in a compound called cortisol. Endorphins are basically a feel-good chemical, whereas cortisol is a stress hormone. So you might can understand whenever you have an increase in the feel-good hormones and a decrease in the stress hormones, you're actually going to have much better results as well. Some other researchers actually looked at the fluid within the knee joint, and they found that there was a reduction in the inflammatory compounds when patients had electrical dry needling. And you might also understand that whenever you reduce the inflammatory compounds, you're also going to have a reduction in pain. So it certainly makes sense that whenever you increase blood flow to the area, you increase the feel-good compounds, you decrease the stress compounds, and you decrease the inflammatory compounds, that you can have a profound effect on knee arthritis. And the effects are so great that you see in some physical therapy clinics in other states, patients who are certainly candidates for a knee replacement have to go see these physical therapists who perform this type of treatment before they're approved for a knee replacement. The results are that good. Please share this with somebody who has arthritis in their knees, someone who might be looking at having a knee replacement. Now, some of them certainly need it. Don't get me wrong. I'm not trying to prevent people from getting what they need, but there are other people who want to put that off if at all possible. Let them know that there is another way, that there is a potentially very, very effective treatment for them.